That's a brief introduction of what we do at Médecins Sans Frontières. So it's emergency medical aid. It's going to be conflict situations, epidemics, natural catastrophes like earthquakes, or a public health crisis like AIDS in South Africa, in Malawi, things like that. And as you've seen, we're an international organisation. We have 20 offices around the world, but 5 offices that run the programs. The other offices recruit volunteers and they do fundraising for us. Now, for our volunteers, without these programs, we wouldn't be able to do them if we didn't have staff. They must speak either English or French. It's one of the criteria for recruitment. But that means that all our documents have to be translated into English and French in order to be able to run these programs. They're very large programs. This year there was a meningitis epidemic, a major meningitis epidemic in Nigeria, Niger and Chad. We vaccinated 7.5 million people. It's a lot of people. And we treated 65,000. So it demands an awful lot of organisation to do these things. And when you talk about organisation, you talk about documents. Whether it's going to be medical onto how to collect a sample of cerebrospinal fluid, whether it's going to be for the logisticians, how to transport those samples to identify what strain of bacteria. You have to transport that medium in a specific kind of packaging. That requires instructions. We sent to the meningitis epidemic 200 volunteers, and we recruited 7,000 staff in those countries to help us. That requires training. You're going to have training, you're going to have training films, you're going to have procedures, etc. All that has to be translated as well. Afterwards, we're going to have, obviously we need money to carry out these programs. So we have lots of communication needs, whether it's going to be for articles on the website, web videos, or whether we're going to apply for funding. We don't apply for very much funding. MSF France, we're 99% on private funds, but sometimes we apply for funding as well. We have to draw up agreements with governments, explaining our activities. That also has to be translated. So there's a whole range of documents that we need that go from one paragraph of a press release that we're going to need the same day or next day to a dictionary on humanitarian law that might be 800 pages. So that's kind of a whole range of documents that we need translating. And as you've seen, by our statutes, we can only spend between 6 and 10% of our budget on administration costs. So all the money that we can save anywhere, including translation, will be money that goes directly into our activities. So what we do for the moment is that we have a network of translators that work for us, either pro bono or professional translators that we pay, and also through TSF. And at the moment we're getting about half our translation needs covered by TSF, the non-specialised needs, so we get covered by TSF, which is an enormous help for us. I don't really know how it can be improved or how. But basically, we need skills that you in this room have. I don't have. We don't have. And if you would help, we need to take it. But it's the same. It's not just for translation, because some people say it's true that translation in general. People tend to view it a little bit like sort of secretarial work. It's kind of, people don't really recognise translation work. It's not the case. It's not the case at MSF. We realise that we need it. And you send a doctor in the field, he needs that document in the other language. He really needs it. But it's just that we have a limited budget, and we want to put as much money as we can into into the activities. We also have hospitals in France that help us doing certain research on certain pathologies. We have doctors who will advise us on pain management. We have all sorts of people from logisticians on how to build new generators who give their time, who give their skills to MSF. And that for us is very precious, because it's all that. It's not only knowledge, but it's also the money that we can save on that we can spend directly in the field. So there you go. Very briefly, what we need and why we need it. There we go. Thank you.
Thanks, Caroline, for that. I mean, now you can see exactly why we do the work we do. And in fact, Translators Without Borders, which I co-founded in 1993, started with Doctors Without Borders, who are our inspiration, still a bit moved by that video, and our namesake and obviously our inspiration. Traducteurs Sans Frontières is how we're more commonly known, because we're based in Paris. We got our start in 1993 when my translation company, I own a translation company called Localisation, which at the time was called Localisation. We changed the name. Well, Doctors Without Borders approached us with a translation project, just a regular paid project. And the light went on, and I said, well, what would you do with the money if we didn't charge you for this project? And they said, well, we could put it into our programs. So that seemed like a great idea. And the more we started doing the free projects, the more we had the sense that we were giving something to support the work of Doctors Without Borders, which is work we support so totally. And other organizations started to hear about us. So from Doctors Without Borders, Médecins Sans Frontières, we were approached by Médecins du Monde, Ashoka, Handicap International, and organizations that do such wonderful, wonderful work. And so we started to create a network. Now we're faced with a problem that we're just running out of capacity. We're running out of project management capacity. The work is done by volunteers. We have about 300 volunteers, maybe 100 who are really active, incredibly motivated people who are professional translators. We vet all of our translators. They'll work at home at night after they've done their regular work freelancing. While the kids are sleeping, they'll crank out another 10 pages. I find that incredible that they will do that for us, and the volunteers are very, very motivated. We don't have a shortage of volunteers. Literally, a lot of, well, we do in some languages, I shouldn't say that. We do. But what we really have a shortage of is capacity to manage all these projects, which is why we've been talking with Reinhard Scheller at the Rosetta Foundation, and we localize for global sites. How can we scale up? Because in fact the need is immense. If you look at, and I was going to pull up my slides, but that's okay. If you look at the organizations that we work for, Handicap International, Médecins Sans Frontières, Médecins du Monde, Ashoka, Action Contre la Faim, Secours Catholique, all of these organizations, they're all literally within a kilometer or two of our offices in Paris. They're all located in the 11th arrondissement, just about all. The International Federation of Human Rights, they're just about all located where our offices are. So if we're doing 1 million words a year, that means that just for the 11th arrondissement in Paris, you can imagine how much need there is in the 12th arrondissement, the 1st. Not to mention in Boston and Rome and all over the world. So we need a way to scale up. And what we've been looking for is a way to put the translators in touch